Welcome to Psychedelic Healing, where we journey through the transformative healing power of psychedelics. I am your host, Sonia Cotto, nurse anesthesiologist and mental health advocate. Tonight, we have two guests, Dr. Howard Kornfeld and nurse practitioner Inna Zelikman, both pioneers in the treatment of addiction, chronic pain, and mental health. Dr. Howard Kornfeld is a medical director and founder of Recovery Without Walls, an outpatient treatment program based in Mill Valley, California. He is a trailblazer in addiction medicine and pain management with over 3 decades of experience. Originally trained in emergency medicine, his passion for psychedelic therapy and advocacy grew after serving as physician in residence at the Esalen Institute in the 80s and 90s, leading him to become a prominent figure in the physicians' nuclear disarmament movement in the 80s, and later played a key role in organizing the Pacific Symposium on Psychedelic Drugs in 94 and 95. In the late 90s and early 2000s, he spearheaded drug policy reform efforts and became an early adopter of buprenorphine, which is Suboxone, in the treatment of opiate addiction and chronic pain, publishing and lecturing on the topic at UC San Francisco. Dr. Kornfeld developed his treatment approach into the Recovery Without Walls model and built a practice around it in collaboration with Inna Zelikman, the psych nurse practitioner also with us tonight, incorporating ketamine-assisted psychotherapy into his practice. Inna Zelikman is a psychiatric mental health nurse practitioner with a specialization in addiction medicine, pain management, and integrated complementary medicine. She is the director of integrative mental health at Recovery Without Walls, blending her 2 decades of expertise as an integrative psychiatric nurse practitioner. She is certified in MDMA-assisted psychotherapy and psychedelic practice with MAPS. She specializes in treating substance use disorders, mental health issues, and chronic pain. Her treatment approach incorporates nutritional medicine, internal family systems, innate somatic intelligence, trauma therapy, and psychedelics. She has been offering ketamine-assisted psychotherapy since 2020 for conditions that include substance use disorder, major depression, anxiety, PTSD, and chronic pain. Welcome, both of you. Wow, what a breadth of education, experience, and knowledge that you guys are providing.
Yes, thank you so much for this colorful introduction. Captures both of our backgrounds.
Oh, yes. You guys have a very extensive history, and I just said psych nurse practitioner, but you've been training and certifying and learning your whole life, over 2 decades. And you're actually studying more, I think, right?
Well, one thing that's constant in our practice is a continuous evolution and change that we embrace, and as our culture is evolving. We're bringing something from what we know, and we're incorporating our model into the new era with a psychedelic medicine, right, as it creates a new, hopefully, a paradigm. So we're, Dr. Kornfeld, really looking to be the right voices, this new movement, and really create an integrative model that we believe is an opportunity for people to heal in the right way.
Yeah, and Dr. Kornfeld, with Recovery Without Walls, it's been years before, even since before in the 80s, that you've been kind of into the psychedelic space before even addiction treatment. How did you get introduced to that realm?
Well, one thing I'm not shy about saying is that I went to college in the late 60s, right. And that was when, at least in the sort of post-war period, that young people got exposed to both cannabis and psychedelics. And I was so fortunate to just be in kind of a nice setting where those were introduced in, a relatively safe and therapeutic way, even though we were very young and very naive. But fortunately, we didn't have cocaine, we didn't have opiates, so we were kind of safe in that little bubble. And it had a big influence on me, that era. But I decided to go to medical school. I was in a medical program. I wanted to do a lot of things in the world, but I thought, well, why don't I just become a doctor? Because then I could implement things. I could live, probably where I needed to be, But I had already had those psychedelic experiences, but in medical school, I would say the atmosphere was not anti-psychedelic, but I was one of the few, I think, that had experienced that, because most medical students were kind of, more straight-laced and all of that. And so whenever I spoke about psychedelics, people, their eyes just glazed over, or they changed the subject or something. And so I had this experience, which was deep, but which probably was only partially finished or realized. But fortunately, I found a psychologist in Chicago who had a foot in the door at this place called Esalen, Institute. And Stan Grof, who is somewhat famous in the psychedelic world as a psychiatrist from Czechoslovakia, he was teaching there. And so I was sort of sent to Esalen to kind of figure out what had happened in college, And it was just, again, such a fortunate, place to land. Esalen was like right on the coast of California with hot springs, and Stan had been embraced by that community, I think, after his work with psychedelics became impossible because of the changing legal landscapes in the late the early 70s, I think. I found that I grew a lot. I was able to capitalize on my experiences earlier. I was motivated when the 3 Mile Island nuclear accident happened to just dive in, because my energy was free. I was freed up, comparatively. And I did that sort of work, but I stayed in touch with Esalen, and I became a visiting doctor in residence there. And I was exposed to people who were trying to move psychedelic research forward at Esalen. There was a connection with Anne and Sasha or Alexander Shulgin. There was a strong connection there, and Alexander Shulgin made the connection that right when the precursor of the atom bomb was developed in 1942, December, what led to the Oppenheimer, film that we've all seen. Just 3 months later was when Albert Hofmann discovered the psychoactive effects of LSD. So Sasha Shulgin liked to say he does what he did. He invented, hundreds of new psychedelic type compounds, because he felt that through the invention of these new ways to develop the human mind, there'd be a chance, at least, to counter this growth of destructive technologies. So it's a little bit of how I got started,
That is crazy that you got to study and learn from the father of psychedelics.
Sure.
Wow, that's great. And so that was really a research institute, like that did studies?
Yeah, Esalen started in the early 60s, and it was a pivotal place. It was considered the birth of the, quote, human potential movement back in the day. And it both is a place where people have experiential workshops and yoga, massage, movement. It's in the wilderness, beautiful wilderness medicine and wilderness psychology. But it's also a place where conferences are organized. And in this beautiful setting, sometimes connections are made between people, and people let their, defenses down and really. So it's a place for that also. And it had a pivotal role in actually glasnost in the Soviet Union, because they were working with people from the Soviet Union and almost helped plant the ideas of what Gorbachev did to, deconstruct the authoritarian state there. So Esalen does have a lot of interesting aspects. And what happened there was that I knew that some of the early researchers, Charlie Grobe at UCLA, the people who first got permission, Rick Strassman, this was after years of trying that they finally, the iceberg started to crack just a little bit. And there was a friendly voice at the FDA. And so we brought together these early researchers and people like the Shulgins and Grofs. And we had this conference, and out of that conference, one of the main things that happened is several individuals said, we're going to do some research with psilocybin because we think, because MAPS was working on MDMA, the Rick Doblin and the Multidisciplinary Association. So let's work on psilocybin. There's a lot of research already done in the 50s. There's a lot of safety research. It doesn't have the stigma of LSD. And then let's find the most prestigious place we could plant the seed so that it could grow. And they found, they decided to work with Johns Hopkins. And out of that came the sort of first pivotal study out of Hopkins that looked at mystical benefits, in people who were normal but religiously oriented people, so it sort of broke the ice, even though it was not a disease model.
Right. And so doing that study and being in the psychedelics, how did you transition from emergency medicine after this exposure from Esalen to addiction? Yeah. How did that?
I had experienced addiction in family members. I wasn't particularly prone to it myself, although I think any of us could fall into it if we're stressed and in the right circumstance. So I don't deny. But I got fascinated with addiction, and there's a famous anthropologist, biologist named Gregory Bateson. There's recently a book about him and Margaret Mead called Tripping on Utopia, because they were involved with psychedelics back in right after World War II. But Bateson wrote a pivotal essay where he linked the understanding of addiction to this 12-step program. Like, why does that 12-step program work? Even though that 12-step program has a lot of problems, it does work for a lot of people. So he dissected it, and it inspired me to partially go into the field. And it was a legitimate way I could say I was going to study drugs. You know what I mean? In those days, it was a established fellowship. And so I dove in. But there was a drug discovery back in the late 60s called buprenorphine. And it was just very slow. It was a unique opiate-like drug that could really manage addiction, could really manage pain. But, the field is so rigid that new ideas, even when they're not psychedelics, new ideas, even in opiate pharmacology, have trouble emerging. But then the wrong ideas emerge, like OxyContin, and everybody should be on these strong opiates. So I was also very lucky, and I just fell into a group of doctors who were pioneering buprenorphine, and I just kind of went from there. And it showed me how a drug where there is opposition to the drug, if it's handled carefully, responsibly, it can emerge. And buprenorphine is still trying to emerge. It's still not being utilized anywhere near that it should be. But it is an example, along with psychedelics, how a new kind of medication, a new chemistry can change. And look, these are ancient drugs, of course, cannabis, psychedelics, and yet we've been deprived of using them, to treat people, and particularly people who are coming off of opiates, coming off of benzodiazepines, coming off of SSRIs that are not functional. But we need every tool in the book. We need every color in the palette. And that's why I'm so excited about this era we're in.
Oh, exactly. Because it's not one size fits all. I mean, I personally know that ketamine doesn't work for everyone. I'm sure you have experienced it. But having that as a tool, all the other interventions that you're doing, that's something that is what can help one patient versus another. I did have a question, though. So because I'm sure people are aware of methadone clinics. That was pretty much what the main way that they're treating addiction for a long time. So how does that differ with buprenorphine now in the Suboxone?
So buprenorphine is called a partial agonist, although it's not a partial pain medicine if it's given over time. If it's given over time, it's as strong or stronger than oxycodone or hydromorphone, or morphine or heroin or what, over time, because it activates the endogenous opioid system, the endorphin system. cause respirations in the vast majority of situations to be depressed, even if it's given in physiologic doses. It doesn't cause a kind of euphoria that triggers the addictive mind, in people who have opiate use disorders. So let's say a heroin habit years ago, now they're going into surgery, they're going to be on opioids, they're going to be on oxycodone or hydromorphone. Those can really trigger the old heroin craving. But if you give buprenorphine, it just handles the pain, and then you could keep them stable on the buprenorphine and taper them off,
Okay.
And Inna might have some interesting perspectives of her own on buprenorphine, because she's been right there with me the whole time.
Oh, yes. I know you guys have been together with Recovery Without Walls for over 20 years, right, Inna?
That's right. So,
wow.
You can see how some of this, as you talked about sort of our history of entering, the psychedelic field, certainly I've been a lot inspired, right, by joining Dr. Kornfeld and Recovery Without Walls 20 years ago. All, in this similar fashion, but from obviously different generations and various things that we contribute into the practice. And of course, having his foundation and me being interested in or inspired even through my own work and pathways and some of the developmental trauma, I really felt like bringing the psychedelic. And I love how you use the word the tool, because we look at it as a very valuable tool. That is, if it's given an integrative model, it can have a great potential.
Oh, definitely. And were you familiar with psychedelics before joining his practice, or how did you work into that? Because you kind of went into the psychiatric specialty, or were you always kind of focused as a mental health practitioner, even as a nurse, or how did you evolve into the director?
So originally I was more like a primary care type of nurse practitioner, but then because we've done so much work in mental health and addiction and pain, I've had interest to become more of a psychiatric nurse practitioner. I just felt that this way we could really treat a broader population, and I think people, when they look and recognize sort of a background, will feel that Recovery Without Walls is a practice that offers to various population that we could treat, right? From mental illness to pain management to addiction. Now, I haven't been particularly, I've gone into more psychedelic fields, I'd say little bit later on in life. At some point we realized even though, I've been a great practitioner for so many years, but I felt like sometimes there were unresolved, traumas that I've had myself, in traveling around the world. I've been able to receive guided therapy, and I really felt like what it did for me and how that transformed me and put me on a recent path that I've been on is something that I felt we could do with our patients as well. I mean, I've been, one of the things that brought us together in a way. Yes, I entered the practice, but there's a reason why I stayed together for 20 years, so our background of philosophy, I've been always like a holistic practitioner in a mindset, which is why I studied functional medicine, right? And dived into, somatic therapies and IFS. It just already was natural for me to have that kind of mindset. It was just the right timing, the right circumstances, and, the right mentors in life. And yeah.
Yeah. And as a nurse, we kind of are holistic just in nature, right?
Yeah. Well, there's actually a lot of conversations that are been happening is that nurse is actually best positioned, most well positioned, right, in providing psychedelic therapies. I mean, just the background, empathy and bedside manners, and just being able to be already sitting for the patients. And also knowing, if you think about it, the medical aspect as well as the spiritual aspects, right, and a lot of compassion. I mean, it just sets nursing for really being a wonderful, practitioner field to provide psychedelic therapies.
Oh, 100%. I definitely, all the nurses out there, if you are curious, that is another specialty that you can go into, and it's much needed, especially as MDMA is going to become a treatment modality soon, hopefully in this year. I know that it's in the works as we speak, so we'll see.
So Sonia, since you brought up MDMA, I'll put in a plug for Rachel Newer's book, because she quoted me in it a few times. That's a book on MDMA and that came out about a year ago. She's a very talented journalist and science journalist. And the reason she interviewed me was because that time when I was hanging around at Esalen back in the 80s, that's when sort of MDMA started filtering into different layers of the population and the New Age movement. And it was a wonderful time to be there. And
you could get it over the counter, right? In the 80s?
It was not illegal till, a certain year in the 80s. And before it became illegal, they actually had hearings. And this crowd, the Shulgins and this crowd at Esalen would give testimony to this the federal judge there could rule in favor of MDA, but the DEA could veto it, So the judge ruled in favor of not scheduling it, but the DEA overruled it. I was around during that kind of emergent time, and, it was quite interesting how some of the people at Esalen, a lot of famous people came to Esalen, teachers, and this one gentleman, very carefully would approach people and befriend them and say, do you want to try this? This is really important. That's how the knowledge of MDMA spread to some degree in California.
Well, and I'm very excited that it'll be usable soon for your therapies. Were you familiar with ketamine? Because you guys only started implementing it in around 2020, correct, in your clinics?
Well, I did meet John Lilly at Esalen. John Lilly was the dolphin researcher who really has a mixed reputation, as you probably know, and he became a ketamine addict. And then ketamine was circulating at Esalen around that time too. And so I was familiar with it, but I was really awed by ketamine started to emerge. It started to emerge in anesthesia, of course, originally, then in pain treatment, which I was in, and then the IV in depression treatment. And then, somebody said, well, what the hell? Why not give it as a psychedelic, use it off label for that too. And I was very surprised that it did emerge as nicely as it did without opposition. But as Inna and I both feel, we are concerned too if it's too free, if it's too available. Like you said, in California, we're experiencing a ketamine addiction. We've treated a number of people with pretty severe ketamine addiction, and we do find that there is a chemical addiction part of it as well as a psychological addiction. In fact, our main tool for treating the worst several cases is actually buprenorphine, because it hits the opiate receptor, and if we could disentangle that part of the ketamine effect, we could get a lot more progress with some other methods. But we do find the withdrawal from the ketamine to be quite pronounced, although it may not be a particular tachycardia, but it's an obsession to obtain the drug that can be extremely powerful. Inna is very familiar with the cases we've treated, and Inna, I'm wondering how you would describe it.
So, it's that there's two pieces, right? You were talking about the ketamine addiction. We've treated, let's say, a young man who also happened to have a pain disorder, but the challenge is that the withdrawal symptoms of ketamine are not so classic, let's say, to the opioid system. The way people would.
What are the
heroin? I think the ketamine hits so many multitude of receptors. So it could be looking like opioid, withdrawal. It could look like cocaine withdrawals. It can look like any other addiction, which I think why there is a possibility that many patients are not recognizing the kind of withdrawals that they're experiencing. And as you mentioned, there's also a lack of understanding that there is a physiological addiction, and it's primarily a psychological addiction. There are recent cases that we've heard about people who have this unspecified, pretty severe abdominal pain, and there might have been a suicidal ideation that results because of how challenging the withdrawal is. So I think it's a growing field of really understanding how do we manage these patients, who are having withdrawals. They even created recently a support group, ketamine support group. If you were to go there, everyone's now, in underground, certain world, right? And the population in San Francisco, somebody's got someone who's been, addicted to ketamine and is currently suffering because they don't really know where to turn to. Because we recognize the symptomology and the fact that they are going through withdrawal. We're able to bring, like Dr. Kornfeld said, buprenorphine. And sometimes you have to give a number of different medications to cover so many different receptors, which is, it's complicated. It took this young man probably a number of weeks, a number of months to fully stabilize. And ultimately, this person has a beautiful, a great life, but has taken a lot of hand-holding. So I think the one thing that we can do is that we know how to take care of this, because it's something that, anyways, right, we're pretty well aware of. But I think it will take some time for people to recognize that they do need to seek help and where to go to find the help.
And what would be like the first symptoms for them, for somebody who, because traditionally ketamine isn't quote unquote addictive, right? Sugar and coffee, caffeine, cocaine, all these are more addictive, and it says low. So even myself, I was thinking it's not very addictive. So how would somebody know that they are addicted and need help?
Well, there's an effect, I think Dr. Kornfeld talked about, there are certain symptoms that qualify somebody have an addiction component. But there's also something that's called tolerance, which means the same ketamine dose may need to be increased, at times slowly, at times rapidly to achieve the same effect. That it kind of opens up, the can of worms for people to experience, right, the addictiveness and withdrawals.
So just the obsession, the obsession of the next.
Yes. And it might start off psychological obsession, but later on, if they don't take the ketamine, a person might feel, whatever they might feel, crashed, they might have experienced withdrawal symptoms. So it perpetuates the need to take the ketamine.
Wow. My mind is blown. Learning something new every day. We are going to stop our conversation here for this week. Please come back for our next episode where we conclude my chat with Dr. Howard Kornfeld and Inna Zelikman. So until then, have a great day.